Hi everybody and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed for people diagnosed with chronic kidney disease. Whether you have a low EGFR or a higher creatinine level, we might have a supplement for you. And I'm joined again today by the wonderful, the fabulous, the ever so lovely Dr. Robin Rose. Dr. Robin Rose comes to us from Hawaii. Hello. She is a regular on our podcast. We're working our way through the Bio-Regulators. Dr. Robin Rose has had a long career in medicine, starting off as a registered nurse, deciding that wasn't good enough, moving into family, basic general practice, deciding that wasn't good enough. Alongside her studies, she was studying acupuncture and herbs and all of those good things. And these days, she has a love and a passion for the traditional use of the Russian bioregulators, used in the proper traditional way. Right, Dr. Rose? Not in these crazy ways we see some people using them, but I won't go down that rabbit hole. And apart from that,
these Russians had money to do the research, and they did it.
They certainly did. The story is actually really fascinating with that. But anyway, I digress. But Dr. Robin Rose has had her own journey with kidney disease, having come through the other end of kidney cancer and having a kidney removed. She has become an expert in herself on how to get her one kidney functioning and getting her EGFR up over 80, which she has managed to do. And she is the author of the fabulous Renology is Kidney Success. Hold up the book. This nice, lightweight, light reading book. If you need an extra weight, here it is, that goes through all of the bioregulators, the cytogens, the cytomaxes, and the cytomines are the other ones, and how you can use them in relation to kidney disease. But what's so brilliant about that book, and every time Dr. Rose and I talk, just how you think it's related to kidney disease, and then we end up talking about every sort of other disease and how it's related and what these bioregulators do. And so we're here to talk about all things brain bioregulators today, and the relationship between the brain and kidneys, and why brain bioregulators might be of specific use in kidney disease. So Dr. Robin Rose, welcome back to the podcast, and thank you again.
Always a joy.
Yes.
I have so much fun doing these talks, and I get beautiful feedback. Thanks, everybody, because we're all doing this together. As I think it was Ram Dass said, we're all walking each other home. And in this kidney conversation, we're all teaching each other, and it's a problem. It's the kidney demic. And, sometimes people will reach out to me on my website, which, by the way, Renology is kidneysuccess.com. Lots of info and all of these talks and more. But, I have kidney issues. I'm using the kidney bioregulator. Like, well, that's nice. But what the real conversation is, and this one is a huge one, is that all of the blood goes through the kidneys all day, all night. And that blood, once it traverses all of the complicated kidney brilliant actions, goes everywhere. And so things that affect the kidney is going to be affecting the heart, the brain, the liver. I mean, all these conversations are just constantly happening. I mean, I have this like cartoons of little messengers walking around, floating here, okay, now. And, and so I say this, the kidney bone is connected to the brain bone. And in this conversation, I'll do my N of one story. At first I was quite sick. I had a kidney removed and basically woke up from the intensity of surgery to find out I had a GFR of 30, which, in a simplified way is saying 25% function. Not good. This isn't the no problem, you can live with one kidney. And what I want to say about it is I remember how dysfunctional I was in my executive function, emotional, intellectual disability. I really struggled putting sentences together at first. I was very pleased. I had just moved to this beautiful place in Hawaii, and so I wasn't needing a lot of it until I realized nobody was helping me, and I had to figure out how to get better. And some of that is important message, with CKD, use your brain, exercise the brain. Because, I started looking up potassium and kept going. And I think, that brain weightlifting is really important. It's easy, like, just to space it out. And so putting stuff together for this is really fun for me because I'm better. And like I just told Fiona, one of my dear friends, Dr. Kat Toops, who's the brain genius, working with Dr. Bredesen, basically complimented me that over these years, I've reclaimed my brain and brain function and intellectual ability. And so have hope, stay in that hope, because hope is medicine.
And so many people will comment when I've done, testimonials, talking to people that's gone through the program or anything like that, that brain fog and, inability to think and clarity of thoughts is a huge symptom of chronic kidney disease. So we can't ignore the brain because it is that fatigue, brain fog, inability to, you were saying before, like just read a sentence and comprehend it, then read paragraphs, like that is, something that people, when we're looking at kidney disease, I hear a lot of the time. And so it is really important, like you say, the brain bone is connected to the kidney bone. So this conversation is very important. And it's great. Before we hit record, we were talking about some really cool things of how they relate. So do you want to start into all of that, of why the brain and the kidneys are related, about all things albumin, blood-brain barrier, and all that kind of stuff?
When I know we're going to do this, I'm like, oh, what isn't in the book? Because since the book, I'm already into whole new realms. I mean, it's like this blossoming and then the next blossom. It's really fun. So think of the kidney and brain as kind of one organ. I think of, the kidney and heart. And so all these are really talking to each other. The things that hurt one kind of hurt another. That's what Kat and I have shared over the years. Well, and so they're both high flow organs. Lots of blood goes there. I mean, think of the kidney as a clump of blood vessels, and low impedance and arteriolar autoregulation. Okay, there's a lot of innate ability that the body has to move messages and substances around and coordinate. And when either of the major organs have trouble, it's going to affect the other. It's really the take-home message. But what I found was small vessel disease. So there's big blood vessels and there's smaller and tiny ones. The capillaries are really tiny. And it's a phenotype. In other words, there's over time, the epigenetics of living will cause damage to these blood vessels. And that's, imagine the pipes in your house aren't working. What happens with your toilet and what happens with your bathtub? Not good. Don't want that in my brain, do I? And so what's this phenotype? It's, okay, endothelial dysfunction. We know about this. Keep that in mind. Early ways to offset this problem. Impaired vasoreactivity. So the blood vessels are supposed to listen to messages and respond in ways that the body's calling for. When that's not happening, there's dysfunction downstream. Leakage. I wrote a blog post about how kidney tubules leaky kidney, just like leaky gut. We also have leaky brain, and the same tight junctions are damaged by the same forces in all of these places. And all of this ends up just vicious cycling tissue injury. So it gets worse. And so what happens when the small vessel disease is affecting the whole body? Not good. It calls like a parallel injury model where, damage is happening in various places, different in each person. And we know that clinically. I mean, nobody shows up and says, oh, I'm just like the last 5 people you saw. I have the same name of a diagnosis, but it's utterly different. And so when kidney declines, brain is declining, even though it may not be obvious. I'm tired. You don't know. Okay, the white matter, the part of the brain that's the intellect, gets changed and on the way to possible fibrosis that we don't want. There's like little lacunas, little like dig holes that you shouldn't get, microbleeds. And what does that mean? Cognitive dysfunction and impairment. I can tell you nobody wants this. And so then what I learned was albumin in the urine is pretty common. Not everybody has it. I've never had it. One cardiologist told me, you don't have kidney disease because you're not, like, whatever. Okay. But when people have it, it says a canary for cerebral microvascular disease. So right there, you can assume, and when we have bioregulators to kind of modulate these risks, sooner the better, it can kind of reverse these things, and that's really important. But it said that albuminuria is considered a cerebrovascular risk marker. Primary care, pay attention. When you see this, think bigger than what the piece of paper looks like. And so even at a low grade, you don't need a lot of kidney decline. This can be in stage 2 easily. And that the systemic endothelial injury is an ordeal for everything, for the eyes, for the lungs. We know this. Next part of this is uremic toxins. When you read a little bit of the literature, it's like, we have, a couple of these that we've looked at. But what I realized, and this is long ago research already, there's hundreds of things that we're living in a world with that when you have declined kidney function, they're going to be toxins, as opposed to people with normal kidney function may be fine with these. And so, you become a little bit of a pariah or a weirdo, like, I can't tolerate these things. Well, I can't. I've had these conversations like, congratulations. But anyway, signaling begins. They're like little terrorists that go around causing problems places. Cytokines are happening. And neuroinflammation means you're not thinking well. Basically, the simplicity of this. And it said small vessel disease in the cerebral cortex is the brain's CKD.
Oh, fascinating. I love that.
I love these kind of literary analogies. And early CKD, there is already white matter burden. It's already damaging. So, when I'm kind of this, I think, a nudge and a pest about this, stage 2 is not normal.
Right.
Okay, we don't have drugs. We also may not have enough testing to say it's happening, but we have a lot of scientific understanding. And for me as that patient, I'm in stage 2 now. I got my GFR, by the way, up to 68 with one kidney, and I'll go get labs again sometime, and maybe it's even better. And I'm humbled to realize some of these things are still happening. And so what I'm doing to support my health is because I know this. And so knowing this information isn't to scare you, but it's to inspire you to continue and know, at least I have things I know to do. I think that's important. And so you track these markers and try to improve the kidney function, which will improve the brain function, and, learn a new language, play an instrument, read books, all these things are medicine. I put a little note in dialysis that cerebral blood flow is decreased. There's not good perfusion, white matter changes are happening, and cognitive decline. So there's a place for this kind of intervention. Even if somebody's on dialysis, they need the dietary and the lifestyle and some of the bioregulatory support. The bioregulators are not dangerous in advanced kidney disease.
No, someone actually asked that on one of the questions on our videos, and I said exactly that. So even on dialysis, my understanding is they're very safe as an adjunct to put in.
I've read that, and whereas I've also found that some of the larger injectable peptides, be careful. And there aren't that many really skilled clinicians to guide that. There are some, But, it's a little bit risky because, the larger molecules, they're not bioregulators. They do stuff, but there's so many unknowns. And so I'm a little more
Yeah.
tenuous.
No, I'm a bit like you, but it's so interesting, since we had that discussion about retinol binding and was it beta-2 globulin? I've been tested. So I've got an amazing doctor. I ran some training with them here in Australia, and we test everybody now. And do you know how many people with normal EGFR, or where you are seeing EGFR that's not too bad or improving, and then we're seeing like just tubule dysfunction? I am blown away by how many people where I go, I think there's some kidney disease here, it's not flagged. Their kidney decline might be in the 80s. It's when I'm checking at 70 to 80s. And we're like, no one's flagged, it's early, we have a high normal blood sugar. So I'm like, they're beginning to head towards metabolic disease, but it's still within range. You check those two markers, tubule dysfunction. I'm like, wow, we're just ahead of the curve here.
Urine, correct?
What was that?
You're checking them in urine.
Yeah. Oh, yes, both urine and blood. We get to run both.
Yeah, because what I understand with at least with beta-2 microglobulin, it could be both. The blood is more indicative of glomerulus.
Yes.
And urine, because and I'll give my rap because I didn't know this until not that long ago. We know about proteinuria. Okay, we have the glomerulus and big proteins get through. That's not good, and there's bad prognosis. It's a target worth working on. But the tubules, which are gorgeous little things, actually also have their own form of proteinuria, but they're different proteins. They're little, and they shouldn't be getting through. And so if you find them in the urine, you can assume that the tubules, which is the discernment of the body, I'm keeping stuff that I shouldn't keep. That's not good. That's the tubule dysfunction. Or, the lysosomal processes aren't happening, and things that are ending up excreted should have been kept. And that's a life skill. Can I discern what I need to do in my life? And so the tubules are like magical, amazing, really mystical teachers for me. So next on my list here is the hormonal axis and the mineral axis. And, we know about erythropoietin, and iron gets messed up in all of this, parathyroid, which we then get to FGF23, and our very beloved clotho and vitamin D. And so, there's right there, Fiona and I are both looking at each other going, I could see the steam coming out. We know a lot of things to do about that. So understanding that there's dysfunction where it looks fine. Really an important thing, and it's been frustrating to me because, I just spoke to someone who thanked me for the help that I had given him. He's 25 years past a nephrectomy for renal cell carcinoma, but she came in my office complaining, I think he was peeing blood, and I'm like, you're getting tested, and he's doing fine. He's actually, being a health coach. However, I said, so, how's your kidney function? Oh, it's fine. His GFR is 60. I'm like, okay, that's fine, but I call this the renal vulnerability syndrome. Because at that point, and mine is 68, so I'm talking about myself as well, I'm fine. But what I've seen is it doesn't take much to get knocked over at that stage. So like I spoke to somebody who was doing fine in stage 2 and got COVID down to the bottom of stage 3, like swiftly.
Very quickly. I've seen that maybe, I can't, fingers and toes past, maybe 30, 40 cases of exactly that.
Yeah. And so, so that's why these conversations that we're having is really important, and the more clinicians that hear this and understand, like, listen to these early whispers. Listen to what people are saying. They're fatigued. Keep this in the conversation. So anyway, what do we see with this aspect of it? High blood pressure, heart rate variability, tanks. It's one axis with two organs, because there's a conversation going back and forth. All of these things are affected by the blood. There's perforating arterioles. This does not sound like a good thing. And you often can see diastolic blood pressure going up in this story with brain involved and also the mean arterial pressure. So, check blood pressures, check them at night too. And that's one thing that I found the hard way personally is I took my blood pressure at 11 o'clock one night when there were solar flares, and my cardiologist, who's pretty cool, said, I think the solar flares are affecting you, because I was feeling like, what's going on? And it was high. I mean, it was like notably high. And in the morning, like gorgeous.
Just systolic.
Sorry?
Both dystolic and systolic, or just diastolic?
Both. It was both.
Yeah.
And that's when I learned about non-dipper status. So normally, the blood pressure goes down at night. The cortisol goes down at night. With kidney disease, how many times do you wake up? How many times do you pee at night? It's a real thing. And so I have rearranged strategies, things. Melatonin at night actually helps with this non-dipper. It's not just a sleeping pill. It's actually to modulate why are you not going to sleep. There's things going on. Learning all the vagus skills that you can learn. It's all really important. What else do I have on my gorgeous list here?
Talk to me about those.
Inflammation, oxidative stress, and glycocalyx loss. Triad, that's pro-thrombotic. So this is, risk for TIAs. People may be having TIAs and not realizing that this is kidney related. Inflammatory tone. There's the barrier leak that we talked about. Leukocytes, the white cells adhese, and that's causing inflammation in the blood vessels. Little clots form. Then you get renal fibrosis. You don't want that. That's basically really challenging to reverse. Endothelial injury. So we have a vicious cycle. And, I talk about renology as the art and clinical science of kidney success, and we turn vicious cycles into precious cycles. Okay, so what happens? You have kidney disease, there's uremic toxin. Even with kidney decline, and we can separate those out, we get the blood-brain barrier leaking, neuroinflammation, cognitive decline, people aren't taking as good care of themselves, and then there we go, more and more, and tight junctions are failing. We see albuminuria, so the endothelium is dysfunctional. Risk for strokes. This is like severe stuff. And when we have glomerular leak, meaning these big proteins are getting through the filter and ending up in the urine instead of staying in the blood, it's harming the endothelial lining all over the body, not just in the kidney or the brain. We also see little micro infarcts. So instead of a stroke, and I've seen this on people's brain scans for years, they have high blood pressure, possibly kidney decline, most likely. I wasn't that hip to this stuff back many, many years ago. So me and everybody else. And on the scans, it's like somebody took a pen and went, beep, 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 beep. And eventually, if enough of those coalesce in the same place, it's like a stroke, and function declines. But, these little micro infarcts are not a good thing. And so there's that, as we talked about with dialysis, executive function is challenged. Many people say they don't feel good. Anybody with high blood pressure, there's, scarring or sclerosing of the blood vessels, and the autoregulation then is compromised. The body doesn't know what to do. So there's blood pressure lability. It's like reacting too much, and end organ ischemia. So basically, what does that mean? Your pipes are clogged. And so oxygen that's floating around in the blood is what can't get where it needs to go, and that compromises everything. Nephron loss and small vessel dysfunction again. So we see anemia, hypoxia, meaning not enough oxygen is getting where it needs to. That means the brain's not working as well. Serious about breath practices, as conscious breathing actually matters with this stuff. more advanced, it is worth it to follow the erythropoietin because that means less oxygen is getting to the white matter and the kidney. And so, okay, what are the qualities? I wrote down, like, what do you see? Visuospatial dysfunction. And I've been aware of that. It's like my ability to perceive things is
Depth perception kind of thing disappears?
different. Yeah, it's like I look at something and I'm not even processing it sometimes. So yeah, I use the eye and brain bioregulators on a regular cycling basis. Attention span, language skills, abstraction skills, delayed recall. I'm aware of all this stuff still. Orientation, hearing issues, and in any patient, these are questions to ask. And people aren't necessarily going to say, hey, my visuospatial skills have been diminished. It's subtle stuff.
Yeah.
But what do? We treat the blood pressure, we treat heart rate variability, we treat glycemia, we treat sleep apnea, we treat lipids. Phosphorus is another one of my howlingly loud conversations because it gets ignored. And 3.5 and above on that normal range is not normal in kidney, and so these two things, this axis, they fail together. They're built alike, same stresses. Keep the albumin in mind. And then we get to move into what about the bioregulators?
So talk to me about
all this is an epigenetic hit, right?
Yeah. And, they often get missed or not thought about in kidney disease. We're often looking at a lot of the other ones that we've spoken about. But I think if people are showing some of these symptoms, especially, the cognitive memory, fuzzy brain, or they've got a family history of stroke or anything like that, I think it's super important. So we've got 4 major ones, a couple of cytomaxes and a couple of cytogens. So do you want to run us through each of those and what they do and the difference and when you would use one over the other?
Sure. So the first one, cortexin, is actually a polypeptide. It's more like an extract. Yeah. And it's a bulky, complex molecule. And there's pluses and minuses of choosing that. In some cases, it's a little too reactivity inducing because it's got a lot of other than just bioregulator to it. I mean, I have, in the book, I go through all, it's larger, 82 amino acids.
That's a big boy.
Yeah, so that, that's a big thing. But on the other hand, I mean, after a brain injury, wow. It's been compared to cerebral lysin, which we know a lot about. And so, when there's a head injury, when there's brain injuries, when there's strokes, even, the TIAs and the lacunar infarcts, not a bad idea, toxic exposures. And again, I think this has to be the clinician involved who really has to know this. It's a hard one because, like I said, you and I need to get busy and educate more clinicians so that we have colleagues doing this. We can't do it all. So, I have all kinds of things here about cortexin. There's anti-cancer benefits. There's ophthalmologic benefits. It's helpful with diabetic retinopathy, with macular disease, optic nerve problems, glaucoma, etc. So, it has a place. Do the other of this class do that? Probably. I've heard Professor Havinson say basically any of them from the class have benefits and effects. You and I have talked about, in an intense situation, you start with injectables, which tend to be more kind of focused and intense, but short acting. And then once there's change, you can kind of subtly and maybe longer time use these orals that are gentler, but longer acting, And so then we move into the synthetics. And I have this ongoing I feel like, I'm one of my growly little Jersey girl things, because pinealon sounds like a pineal peptide, doesn't it? What a bad name for this stuff, because it isn't. It doesn't do it. I mean, I've heard like well-spoken people do big talks about this, and I'm just going, "Ah." So it basically is a brain bioregulator. I mean, yeah, the pineal is in the brain, but this is like a lot more generalized thing. It's not going to do what and we did a great chat about the pineal ones last time. But it does work with DNA. Magnesium tends to optimize it. I think that this is a great choice with people who are presenting, I have kidney decline and man, I can't focus. I mean, the other one is also, cortigen. Whenever you hear gen in one of these, think I call cytogens are the ones that are synthetically generated. That was how I finally memorized that. And cytomaxes are the extracts that are purified. They're bigger, a little bigger molecules. So they're more max. But ultimately, the cortigen is more specific from the cerebral cortex. And so, when there's intellectual issues,
Memory, executive decision making, cerebral circulation is another big one that cortigen I'd use that for. Very age-related cognitive decline, memory, mental fatigue, post-strokey sort of stuff versus the pinealon, which is more deep neuroprotective, neuroregeneration, and antioxidant, anti-aging, as you mentioned. And that has more of the gene expression. It's sort of my understanding, tell me what you think, but the pinealon for me is got more of that chromatic unravelly part to it versus the cortigen that's, I mean, they're all going to do that, but that's more, generalized sort of, like you say, it's specifically for the cortex and things like that versus...
they're going to work a little bit differently on which genes and which chromatin. That's something I said before. I mean, I don't have that memorized, and there are people who are way smarter about genetics than I am, that each one of these, my cartoon gets in the cell, gets in the nucleus, lodges in the DNA, stretches it open, and then each uniquely works with different histones to alter the way the chromatin is. And I mean, Covinson's stuff goes into this deeply, and I just kind of went, okay.
Don't worry, I
want to know how to use this clinically.
What do I need to know to get better clinical outcomes for my patients? I want stuff.
And I mean, it's important to understand, because once you understand, oh, okay, this is different. I mean, I don't have to know what's the name of that histone, but to clinically choose which one in a specific case, clinician discretion is a precious thing.
Absolutely. I couldn't agree more. There's after we did that, or I ran that training with everyone in PepDoc, I realized there is really an absolute art in the order. And I mean, the Russians knew this, the order in which you use them matters, because you get this domino knock-on effect. And if you get the order right, you get really amazing results very quickly. Whereas if I haven't got the order quite right, I have to go back and rejig it until you get that domino knockover effect. But that's what I'm looking for in a patient, is what order am I going to use these? And am I going to I do put in layer in peptides every now and then to capture a second domino effect going off this way to maximize it. But there is an art in that. You don't just chuck them in and hope for the best. If you can get them in the right order and do them the right way. I have seen, like I told you, 3 bioregulators, and someone got out of their wheelchair from rheumatoid arthritis. So I don't think they had a spinal cord injury, or I was making, no Jesus moves here. But pain regulation and inflammation coming right down was mind-blowing. And that was just getting them in the right order.
Yeah, exactly. And, I get messages on my website from people, it's like, oh, I read this stuff and I'm taking, blah, 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 blah. And I'm like, I mean, and actually, I've been reading about how with chronic kidney disease, excessive peptides can harm the tubules, right? I mean, they are low molecular weight proteins. And so,
yes,
taking breaks,
cycling,
Everybody says, oh, use Pilotex for long periods of time. Okay, yeah, you can. Stop sometimes because the body needs to kind of recalibrate. And it's not like, different with the larger peptides, but I was really interested. I kind of went down a little rabbit hole about peptides harming tubules because it's like, okay, I'm talking tubules and recommending peptides and bioregulators in that as well. And so, I like the Cytomaxes. For most people who aren't like super sick, I mean, I had a conversation with someone today who just has early up and down-ish stage 2 stuff with Hashimoto's, and an array of other things, with a little mold, a little heavy metal, that things that are getting taken care of. She's in very good hands, but I lost my train of thought. Uh-oh.
You were just saying you really like the Cytomaxes and how they work, so you were going to use a Cytomax.
I got like thinking about her. She's well. And so we're just going to start adding some Cytomaxes gently to, a prolonged amount to address the thyroid and blood vessels and liver. That's my beginning with her. And then, we'll kind of take it slow. And she understood that, that there's layering of this and get around to adrenal thymus pineal at some point, not just hop right into thymus.
Yeah, and because there is no specific kidney cytogen, I'm often used, like I had a case just very recently with an FSGS, so fibrotic basement cell membrane stuff. She had a 31 EGFR, and I just put in Vesogen and Pilotax together because the fibrotic components. And yes, I put in vitamin C and silica and fish oil and all the things we should do, and the dietary changes. She was on an experimental drug. I have a very good pharmacist that will come in and review everything for me because she thought it was a ACE inhibitor, and she was already low blood pressure, so we didn't think high blood pressure was driving anything. Anyway, this pharmacist agreed with me. It was just a gut feeling thing, but I wanted the pharmacist, so we took her off the experimental drug because we thought her kidney had declined quite a bit since going on it. And we're like, well, it's not doing what it's meant to be doing. And then all I did was Vesogen and Pilotax, and she went from 31 to 38 in 4 weeks, which is amazing. I wouldn't say it's just those. She did everything else, like lots of low-hanging fruit, but that lovely pairing of them together. And, they do, those Cytomaxes are really lovely. And now I've just moved her off the Vesogen onto the blood vessel bioregulator. We'll just keep her on the Cytomaxes.
Yeah, exactly. I mean, and I told the person I talked to today, she's like, oh, I have trouble swallowing pills, which I can relate to. I used to. I've fixed myself. You can dump them in a smoothie. You can dump it on your food. You can do it with food. I removed the post in our doctor group where one of the doctors put AI information. You have to take this on an empty stomach. It's like, no, those are different. Those are the other peptides. Yes. I told her I was taking it away. So sirlutin, is a lovely thing. I mean, I cycle sirlutin every now and then.
Oh, we're moving on to the Cytomax. So sorry, anyone just following along. We've finished with Cortigen, which was the Cytogen, and now Dr. Rose is talking about sirlutin, which is the Cytomax, the capsule. We're moving on to the bigger guy. It's okay. It's all good. I'm all over here. This is why I'm here, Robin.
I'm not too linear. I'm sort of like...
It's all good. You're a flowy flower petal, and this is why we love you.
Scribbler. I mean, it's tissue specific. It's, you can, I mean, there's been studies where they use the higher doses. Like you can do 1 or 2 capsules 2 or 3 times a day in a more significant case.
What would you, when you say significant case, what would qualify for that? Because I've never used big dose. I've never used big dose.
Post-stroke, it could be, in vascular encephalopathies, where there's EEG abnormalities, maybe seizure disorders, and I've done that a couple of times. like short burst, sort of like doing it as if it was using a cytogen first, just high flushed it, but not for long, especially after what I read, with it, that there can be some issues with the tubules. It's like I want to just explore this a little bit more, but it can be done. I mean, post stroke, I would ask somebody to do that for me.
Yeah. Well, yeah. I mean, would
Unless
you use that
somebody
over?
kindly came and gave me shots of it, which
Would you use that over something, say, cerebral icin, or do you use them both together? Just, I'm curious about that because I'd obviously go for cerebral
you
icin,
could
but
use them together. I don't see why not.
okay.
I mean, I got interested in this because, at least in the States, I mean, cerebral icin was getting challenging to find. And so this was like, cool, we have options.
Okay, good to know.
To me, it's unfortunate, but one thing that's important for people to realize is that the risk of stroke when one has chronic kidney decline/disease is very enhanced. Like I've read anything from like 5 to 30 times the risk.
Yeah, I've read the same.
Even more than that, I mean, so it's a who knows, because, that's a big variety in numbers. It didn't matter to me if it was 3 or 30. It was like, got it. What can I do? And I mean, I like ginkgo as a supplement. It's really nice for blood pressure, but it's always been, sort of a nice brain tonic. And I'm not going to go into the whole ginkgo conversation here. You need to know stuff and know risks and benefits and all of that. But there's a lot of ways to support brain. Eat arugula, make sure the nitric oxide's good. Again, circulation. These are circulatory organs. They're clumps of blood vessels with other tissues hooked up to them.
Yeah, very important point. I think that's we forget that.
Yeah, so it's been an interesting thing to help people understand what symptoms they're having and recognize it's connected. Because I don't see clinicians understanding this, and so our patients aren't getting it, that there's not fragmentation. The kidney's talking to all these different organs, and if you're feeling cranky, tired, whatever, it very well could be not because you're a dumb person, but because you have pathology for which we have good remedies. Low-hanging fruit and supplements and peptides and bioregulators. I mean, there's so much, red light, I mean, all of these things. We have so many things. And so, that I try to encourage the people who are reaching out to me is like, maintain your hope, be willing. And when you hear the doctor tell you, well, don't expect to decline.
Oh,
I was told that. And, Jersey girl stepped up inside of my head and I mean, you got to get a little feisty about that, because the other part of me came home and cried for 2 days.
yeah, fair enough.
And what happens with that? There's no point in bothering. And so like these aren't trivial things. It's such an important part of this conversation is, I mean, we've talked about that, it's the spirituality aspect and the emotional aspect and tolerating the negativity of others, which is inevitable in life, especially when it comes from the doctor, it's like.
That's back to your tubule conversation though. What am I going to, filter in and what am I going to take out? I love that when you first said that. I'm like, that is so true. The tubules are the nuance about how we go through life and what we allow into our energetic field and what we let go of. And since you mentioned that, I actually talked to my kidney mastery group about exactly that. I'm like, I'd love to know just where are you not setting boundaries around that sort of stuff, and really just start to bring awareness to that, because that will energetically. It's
I mean, think about it. Like you have, transporters that make decisions about sodium. Okay, so what? But, you end up with too much sodium in your body, there's like nasty things that can happen down the line. And as adults, we have the ability to perceive to the future from the past. It's like when you're a little kid, you don't know how to do this. But, I realize like as an adult, I can recognize that what's happening now could end up being more serious. Maybe it won't. So I want to do stuff that isn't dangerous, and this is for self or others, that might, God willing, and very well might, remediate some of the early subtle possibilities. Like, okay, brain stuff is potential in this syndrome that I have. My vulnerability is clear to me. I'm going to include brain-wise behaviors, and I'm going to run a bioregulator now and then.
Yeah.
And it's so simple. And yet, again, I say this not to dissuade people from trusting their doctors, but what I found is primary care really hasn't quite figured out enough of what to do other than naturopaths, which my gratitude is because naturopaths helped me get better. Like I fell over and I got uprighted so I could continue. And the nephrologists are very busy with very sick people.
And very focused. They're not thinking about your brain.
Which doesn't make sense to me because, this is all nephrology literature. It's known. And I am seeing more like, the nephrology news that I get, there's more stuff about connection with the parathyroid. Oh, okay. And that means phosphorus, and that means bones and heart. And there's more of this happening. And so the more we have this conversation, the ripples will go out. I live at the ocean, so I have this image of, you put stuff out and it circulates all over. It's going to affect everybody. And, and so continuing to ask the questions. I always sort of giggle when somebody tells me, I got your book and I'm going to bring it to my nephrologist. And I haven't gotten much positive response from nephrology. This is like, isn't this what we wanted? Is to help people early, not need a transplant or dialysis. God bless you if you don't, God bless you if you need it and you can have it. Okay, but I don't want that. I don't want to get there. And most people I talk to don't either. And so I have a couple of lovely functional nephrologists who, are starting on this pathway. And, there are more and more people getting it. I had a conversation with a rheumatologist who's like, I'm using these in my practice.
Wow. And we've got that amazing Springer Nature medical text coming out. I just saw the contracts come through today, which tells me Springer Nature Switzerland have got the book about to print. So that conversation will start. Pretty sure I had Pilotax in there. I definitely hadn't. I had Foxo4, I think. Anyway, I didn't. At that time, it was just before my love affair with bioregulators, unfortunately, because I would have put a whole thing in there on them. But at least we can start the conversation about all these other things of the kidney bones connected to the brain and the parathyroid. That's definitely all in there. So at least that'll be going into medical schools.
I think people are using bioregulators. See, my thing is still doing this movement thing. Good computer, you guys. Anyway, there's a learning curve to understanding that they're different. They're not a pill for ill, and people are using them in that way a lot more than I think is appropriate because it's a really unique tool. Peptides don't gene switch. They do other things.
No, and they're very nuanced because peptides are a bit like, I call them like a sledgehammer. People get pretty big, decent changes. Let's just talk about BPC-TB. People are suddenly halving their time of a broken bone. Like, that's significant. Maybe, and I actually have seen bioregulators do amazing things, but generally, because you're just getting this lovely epigenetic expression, and then if you've nourished and fed and put the fertilizer on the body to heal itself, I find, and how I like to use them, is you're upregulating the body to have a better epigenetic expression. It'll take longer and it's slower and the garden starts to grow. It's like, I moved into this place 3 years ago, and I was like, why does my garden not look like House and Gardens now? Because I'm used to my dad's garden, like it was amazing. But 3 years on, I'm like, my garden's starting to look like House and Garden. But it took 3 years of, getting the right things, finding what will grow under my darn casuarinas that drop pines everywhere and what will grow here. And that's how I see these beautiful bioregulators, especially the cider maxes, is you are planting and getting epigenetic expression. But if you're not giving the body good epigenetic material from good sleep, eating well, you can't take advantage of this unraveling of the chromatin and this improved epigenetic expression. They're not like bioregulators, peptides that will up and down regulate these biochemical pathways, sort of regardless, although I still say with peptides, you still need to be doing all this other stuff.
Epigenetic max.
Yeah. But if you've got someone like me that's spent years fertilizing the garden and setting it up right, and you put in the right dominoes of bioregulators and then you give them a little flick, that's when I see they're amazing. And for me, they are far more powerful than the peptides when you've got a good clinician that's set up this domino effect and you've done all the stuff that you always talk about, the low-hanging fruit. I love them because you are getting permanent epigenetic improved function. And I don't know anything else, apart from maybe meditation that they're now proving with Dr. Joe that does that. I'm yet to find it.
Exactly, and that's part of it. I mean, that's like a non-optional low-hanging fruit, is cultivate learning altered brain frequencies. I mean, it comes with the unit. If you don't use it, it atrophies. And one thing I wanted to say is bioregulators, I mean, you can use one and you find something, but really, somewhere in the book, and actually I don't remember numbers that well, but there's like 70 different kinds of cell types in the kidney. So what you're not using one thing, okay, cartilage, all right, and blood vessels, and so it's not like, okay, I'm just using a brain bioregulator, to point, you've said this beautifully. It's, the combination, they call it bundling. I like that. I like that better than stacks. They bundle them, and it's like, it's kind of cute with a little bow, and here's your stuff. And, I think that it's like salad. You make a salad, it doesn't just have one thing in it. It's like, okay, lettuce, boring. And so, with bioregulators, the art of it and understanding what's happening as they're entering this terrain, which, like you said, you can put them on a soil terrain and probably see some benefits, but they might be suboptimal or temporary, or, it's like if you're keeping on getting these hits, what do you expect? I've had people go, oh, yeah, now I'm better. I'm going to start eating, blah, blah, blah. Like, you're wasting my time and yours, because we're going to have to start all over with the conversation. And that's unnecessary, when there's something, I don't know if I'm crazy, but the energy that I get, the joy of accomplishing something, self-loving, self-caring, and seeing the outcome. I was really sick. I love having people reflecting to me because I was still me, but I didn't realize that the soiled external. And so there's a real joy about that, just like planting your garden. Wow, look at this. I have absolutely beautiful datura, these beautiful trumpet flowers. It's been raining a lot and they're gorgeous. And I've cultivated another one that's coming up. And so soon it's going to be this floral archway that people walk through. You'll see, because you're going to come visit. And and so, I know this is far afield from talking about brain bioregulators, but, all of this makes this stuff more effective. Mm-hmm. It's all medicine. Mm-hmm. It's like I'm watching myself, like if I'm sitting here for a longer time, I want to sit up straight, because I'm going to sit like this. There's consequences. Mm-hmm. And so, don't doubt that every effort that you make in caring for yourself, see, there it goes again, that's weird, counts.
Yeah.
It's like getting an antibiotic from the doctor. It's just the same thing as hydrating with beautiful herbal teas that are kidney friendly.
Mm-hmm.
A la vida. And so, we're all in this together. We're caring for each other. I mean, I adore this relationship you and I have, and we're both learning from each other, and it's incredible. I mean, it's like this big love affair with healing, and as the wounded healers, I mean, we really have to do it both. It's like I'm giving, but I'm also really
Yeah, that
gaining.
one's not lost on me. Yes. Yeah.
So never to even minimize the thought that I have diminished kidney function, but my brain's fine. It's like, well, it may be fine, but let's keep it that way. Let's maintain that, and if you have a GFR in stage 2, you don't have to think, oh, I'm sick. That's why I like my CK little d.
Yeah.
It's like we're not making a disease out of it, but those of us who believe in preventive practice listen to more subtle things that you can treat with more subtle therapies. We don't need to put prednisone on early disease. I mean, you can change diet and do it. I mean, the allopathic way is get sick enough so that we can smack it and get rid of it. And it's more than that. And I'm grateful for my education, but it wasn't a complete sentence.
No, nothing is. And we're still learning. That's the other amazing thing that, it's happening in this field. It's opening up and we're understanding more and more. And, I think there's a lot of hope for health and humanity coming with things, but we'll just see what Big Pharma lets us get access to, what they don't. Anything else you want to add, beautiful Dr. Robin Rose, before we wrap up this lovely brain bioregulator chat?
I think we have done a very nice job with this. I encourage people who are interested in this to consider taking a look at my tome, which is really, I call it a physician's notebook because it was the book I needed and I'm willing to share. Clinicians are appreciating it, and also people who are intelligent lay people, because it's a little thick. Some people are like, whoa, this is over my head. No, it isn't. You just like, I research in this. I don't know everything in this book. I put it all together and go back to it. And so it's useful. My website, Renology is kidney success, keep saying that, .com, is, there's a way to find me, communicate. A lot of people have. I appreciate it. I'm slow sometimes. I don't have a secretary, so I'm sloppy with this, but I have good intentions. And I've been doing lovely blogs, which is my inspirations. And as I'm going, oh, wow, look, this is cool. Like I'm learning about tubules and nobody knows this. Let's talk. And lots of blogs. And so, let's engage, because this is really just a little village of us looking for how do we get home.
I love that. Well, I'll put in all your links and details below. But yeah, if anyone wants to do that, I'll put in the Renologist Kidney Success link for Dr. Rose below. And if you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Instagram and Facebook under the same lot. We are going to start keeping the Bioregulators, the cider maxes, on to Kidney Coach. We'll do that in the new year, because so many people have trouble finding them and getting them at good prices. So Duncan and I have made a commitment that we'll start with the blood vessel and the Pilotax, and we'll just build up the repertoire of not the injectables, but the Cytomaxes, and we'll keep.
So people can go to your website and find them.
Yes, and I'll do it all through. I've already talked to Colleen and from IAS, and we've got it all ready to go. So, and the reason that we are keeping Nature's Marvel is because Phil Markins, who I really respect, who worked with the Russians and who worked with Cavison, we know the process is done properly for those. They have to go through a lot of very specific steps to be able to be called bioregulators and be cleaned and purified. So that's one of the few brands that I know. There's 2 brands that I know, but that's one of the few brands that I know and trust to do that I get good results with. So we'll have them up hopefully sometime in the new year. We're just going to get through all the cyber sales and other bits and pieces. We've got clinical trials coming and all these kind of things. So in the new year sometime you'll see them appear on our website. So
Thank you for doing so much. It's really lovely.
Thank you for the inspiration.
Yay. Yeah.
Yay. All right, my beautiful Dr. Robin Rose, we'll see you next time. What I was thinking, maybe the pancreas bioregulator and all things diabetes next. What do you think?
That'd be nice, absolutely, because everybody knows when you ask people what causes kidney disease, diabetes is right off the tip of the tongue.
Yeah, I thought we could do that bad boy next. All right, I will see you next time. Thank you for being part of our community, Dr. Robin Rose, as thank you for always being your lovely self. We'll see you next time. Bye.
Bye, everybody.